She was only 6 weeks old. She was 6 pounds, 12 ounces. She was very tiny. They told us our white blood cells were triple the amount and that she had a cancer and they didn't know what it was. I thought, no, you got it messed up. Something's wrong or something like that. And then the next day, they came back saying that she had A.L.L.
Acute lymphoblastic leukemia, A.L.L, is the most common cancer we see in children.
By definition, that made her a very high-risk patient.
They said they had to start treatment right away, so we stayed 3 months and 1 day here. High doses of methotrexate, she had every side effect.
Being as young as she was and receiving the intensive therapy that she did, there were all sorts of other complications that came into play. Infection, problems with how she was breathing, problems with how her heart was able to function.
Those treatment complications can be as serious and devastating as the disease itself.
It was obviously an unbelievable stress on both her body but her family as well.
She caught 3 deadly viruses. She couldn't breathe no more. They slipped her into a coma, an induced coma. They were trying experimental drugs. Infectious disease control was involved. They said that she probably wouldn't survive. They did everything they could, and she beat the outcomes of what they said that the survival rate was and everything, and they treated my daughter, my baby, like if it was one of their own. They didn't stop fighting, you know, they gave her they always tried to find for something else to make her survive.
It's because of children like Sophia, that's what keeps us going.
Patient and family-centered care, it's part of the culture here. We are focused on the entire family, their entire support system, bringing them into the fold, making sure that they're part of the team, they're part of the decision-making process.
They know that they can trust us with, you know, the care of their own child because we'll take care of them like they're our child. I
remember a doctor stopping for like 5 minutes before she put a chest tube in my daughter, and that touched me right there, that here's somebody who's taking care of my daughter and she's praying before she puts a chest tube in my daughter. They're amazing people to be around. Dr. Kramer was one of the first ones that came in the room to help us and to get everything going, and Dr. Cauff has been there every step of the way. To me, they're like angels because they've helped us out in so many ways.
Sophia is now 3 years old. She's, you know, if you saw her running around, she looks like every other 3-year-old. She's a healthy, vibrant little girl. We see what is, you know, nothing, you know, short of amazing to see this little girl who we met basically when she was born, so sick, just running through the halls now.
We volunteer, we talk to parents. I would give anything to this hospital to help them out. I wish I could give them more because they saved my daughter's life.